Hi guys, welcome back to my channel. It's Dr. Nina here. So today I'm meeting up with Katie, and her main concerns is basically the lower face. So she had some toxins, some Botox done previously, but what she's not really happy with is the mid and lower face and the cheeks. She thinks they're too flat, the areas around the mouth. She's not quite ready to have a non-surgical procedure in terms of lifting, such as PDO threads or endolift. However, she's very keen to have a little bit of a touch-up of fillers to try to soften all those areas of concerns. So what I'm going to do today to her, it's a combination of derma fillers based on hyaluronic acid. So I'm going to do a bit in the cheekbones, in the nasolabial folds, marionette lines, and in the lips as well. Lips. Okay, so I think genetically you have quite small lips. So have you ever had any lip fillers before? You did, yeah. Right, which in fact, as I'm looking closely, I can see because there's a tiny bit of migration above the vermilion border. So what we aim to do is to roll the inner mucosa outwards. So you do have a very tricky shape called the M-shaped lips. So what that means is that it takes time, it will be a process, a journey to build your lips. If we inject a lot, it may just migrate, so we just need to build it really slowly. I will do a combination technique of cannula and needle to give some volume horizontally and to try to roll outwards as well. Perfect. Okay, let's go into it. So just lay down for me. Okay, so I'm gonna do her lips. So naturally you can tell that she has just thin lips. Naturally we call it a M-shaped lips, which means the upper mucosa, which is the pink part of the lips, naturally wants to curl inwards. So they are tricky lips. It means that in these situations we can't just simply inject a large amount thinking and hoping to get more volume, because in those cases we will risk actually to have migration, which means the filler can migrate on top of the upper lip and give the very unnatural projection. So my advice is to build up the lips. So explaining to the patient that the volume gain will be a process. So in those cases I recommend, instead of waiting the full 6-12 months for the fillers to go, to top it up and build potentially every 3 to 4 months. In those cases as well, I like to do a combination of needle and cannula to try to elevate and create some vertical pillars to lift her upper mucosa. So okay, that's good. So open your mouth slightly for me. Thank you so much. Lovely. So tiny pinprick, sorry about that. So this is the cannula first to build the volume. For lips I like to use 25 gauge. It's a bit smaller than the one I use for the lower face. Lovely. So I'll make sure I go in the body of the lips, checking I'm in the right place, right there, and then I'm just going to gently start to inject. Lovely. Okay, feeling okay? Yeah. Open slightly again. Lovely. Great, okay. And now if you can just turn towards me, please. Thank you. Lovely, exactly the same on the other side. Small sharp. So the cannula, as you can tell, because it's completely blunt, the treatment is comfortable, is not very painful. The cannula allows to be more safe. However, it may does trigger a bit of swelling for a couple of days later. Lovely. Okay, well done. Okay, close for me. Great. We built the volume of the lips by using a cannula, and what I'm going to do now is just give more definition. So when she smiles, the upper lip looks a bit flat, so we just want to create some vertical pillars to kind of elevate and try to roll the mucosa due to her M-shaped lips. So whenever I do derma fillers, I always like to massage the area thoroughly. Not too much, because those fillers are already really good and they integrate nicely. But I just want to make sure, first of all, that there's no complications, there's no occlusions, and also if there's any temporary lumps due to either a hematoma, a small bruising, or a little bit of fillers which hasn't integrated yet, I just massage it. And a degree of swelling and tiny bumps can always appear after 7 to 10 days because the fillers attract the water from your face. So in that case, if that happens, Katie, she's more than welcome to massage the lumps on her lips with very, very clean hands. But most of the time it just doesn't happen if I do this. Nice. Okay, so great, all done. So we can just take our photos, yeah? So I'm just going to show you. So stay there for me. So there you go.
Oh my god, that's amazing! That's amazing!
I know. Looks really good, doesn't it? I know, they just has lifted everything really nicely, and it just now look better and better. Of course. So what I'm gonna do, I'm gonna remove this. Lovely. Okay. So no problem.
With the devil, but he doesn't have a